Everyone, thank you for being here today. We're just going to give it a couple more minutes for folks to trickle in, and then we'll get started. Thanks for your patience. Okay, thank you everybody for being here today and for attending our webinar series at the Firearm Injury Prevention Initiative at the University of Colorado Anschutz Medical Campus. Our goal here is to spotlight novel, important efforts in the community, educational, research, policy spheres that are advancing the state of firearm injury prevention across a broad range of contexts, settings, populations. And in line, I think, with our main approach here at the initiative, with a special emphasis or spotlight on efforts that are collaborative in nature or multidisciplinary. With that in mind, I'm truly excited to announce our speakers here today, Caleb Morse and Dr. Gala True, who will be presenting on their work with the Armory Project, which is a community-partnered approach to providing temporary out-of-home firearm storage. Dr. Gala True is an investigator with the South Central Mental Illness Research, Education, and Clinical Center at the Southeast Louisiana Veterans Healthcare System. She's an associate professor in the section on community and population medicine at Louisiana State University School of Medicine. Her current work in suicide prevention is funded by VA Health Services Research, the Office of Rural Health, and the Office of Mental Health and Suicide Prevention. She's a co-PI on a VA study that investigates the impact of services to address adverse social determinants of health on suicide risk and mortality. She's also co-PI on the Veteran Informed Safety Intervention and Outreach Network, a coalition of research veterans, military families, firearm retailers, and instructors, and other VA and community stakeholders focused on changing the culture around lethal means safety messaging and promoting community-based interventions to prevent firearm suicide. She's also a PI on a project focused on engaging military caregivers in lethal means safety messaging. Caleb Morse, also here today, is an 11-year Army combat veteran with multiple deployments in support of Operation Iraqi Freedom. He's a Louisiana native, and he's also the owner and operator of the Rustic Renegade, a firearms retail shop in Lafayette that also offers coffee, gifts, and a gathering place for veterans and firearm enthusiasts. Caleb is a founding partner in the Armory Project, which they'll be discussing today, which promotes secure firearms storage messaging and offers out-of-home storage options within his gun shop. Dr. True, Mr. Morse, thank you for being here today. And with that, I'm going to pass it off to you.
Great, thank you. So Caleb, if you can unmute yourself. Caleb is going to start by sharing a story of firearm storage through his work with veterans and other customers at his shop.
So the story I'm going to share with you all is about a gentleman who's a good customer of ours, and it actually more relates to his son. So his son was an Army veteran. Great guy. He'd come in our store quite a few different times, was a good customer of ours, and he married the gentleman we'll call Billy's daughter. Beforehand, he was an avid hunter, great shooter, competitive shooter, and really enjoyed the sport. Unfortunately, he didn't find out about our program or seek the help that he needed prior to. We had some small run-ins with him at a few points, not us personally, but just law enforcement throughout. Got married to Billy's daughter. They had a wonderful couple months in their marriage. Went out and for Mardi Gras of last year, which is a big holiday for us in Louisiana, and kind of overpartook a little bit of alcohol. his depression and his PTSD that he struggled with began to kick in. That night they got home, he threatened to shoot and kill his wife with a handgun. They had a small argument as that ensued because she wasn't going to back down. Very strong woman. He shot at her twice as she fled the scene, and then secured a rifle and shot himself. After that, Billy came to us and recognized that he wasn't in a place where he can continue owning his firearms at that point in time, and wanted them held. We held on to quite a large number of firearms for Billy, and continue to hold on to some of them. Since then, he's gone to seek counseling. His daughter is going to seek counseling, and he's become a very, very avid promoter of the Armory Project and what we can do. He's learned now the importance of recognizing and realizing things before they happen, and intervening and making a difference while you still can. So, I mean, Billy and his daughter are phenomenal people. The late husband was a great man. It's just the demons that he struggled with became too much for him to bear. And these stories are the reason why we do this.
Thanks, Caleb. So we wanted to start with a story that illustrates the work Caleb and other federal firearm licensees or gun retailers are doing in the community, and how we've been able to partner with FFLs like Caleb and others. But I'm going to start with a very brief background, because I'm assuming a lot in the audience already know a lot about this or can look it up themselves. But I just want to give a couple of quick numbers of context about veteran suicide and firearms. So the most recent numbers from the VA show that while the veteran population actually experienced a decrease in the suicide count and rate, the percentage of veteran suicides involving firearms continues to increase. So as you can see from this slide, it's about 71% across the board of veteran suicides involved a firearm. But what's really alarming, especially, is the upward tick, but especially the change among women veterans who die by suicide using a firearm. And so that's a particular concern in many ways, but we also really are thinking a lot about the veterans who don't come to the VA for healthcare, who don't have any kind of interactions with the VA. And out of the veterans who die by suicide, more of them are not interacting with the VA. So we really recognize that we need to be working with community partners like Caleb, leaders in the firearm owning and veteran communities to reach those veterans. So in highly rural states with high rates of firearm ownership, the percentage of suicides that involve a firearm can be even higher than that 71%. So these are the most recent numbers that we have from Louisiana. And we use this slide when we go out and talk to firearm retailers, firearm owners, and veteran communities to say, really answer their question, because they'll ask me often, why are you focused on firearms instead of some other means of a person dying by suicide? And when I show this slide, I think it really brings it home for them that if we want to make a difference, we're going to have to address the role of firearms in suicide. But we're also really concerned about caregivers and other family members in the home where firearms are owned and present. Veterans are more likely than civilians to own and be comfortable with firearms. And many caregivers of veterans and service members live in homes with firearms. And some research has shown that more than a quarter of caregivers report feeling excessively burdened by the tasks of caregiving, and that about 24% of caregivers have reported attempting or having thoughts of harming themselves within the past year. So it's not just veterans that we and service members were concerned about, or even firearm owners in general, but really everyone in their home where we need to be talking about secure firearm storage to prevent suicide and other unintentional injuries and deaths. So what's really emerged as the main conversation and main way to talk about this is secure firearm storage. In clinical settings, it's often called lethal means safety, but we really avoid that language in talking with community members and firearm owners, because I've heard people say to me, firearm owners, well, lethal equals safety. Like if I have a lethal firearm, I and my family are more safe. Also, veterans often feel very safe around their firearms. So talking about firearm safety doesn't necessarily resonate. But secure firearm storage is messaging that really resonates. And the VA has started to recognize this. through efforts like, I think it's called securestorage.net, if I'm remembering correctly, but Joe can correct me if I got that wrong. But basically, this secure firearm storage can range anything from more secure storage of firearms in the home and temporary storage away from the home during a crisis or a time when people in the home feel like firearms need to be stored outside the home. So what are some of the barriers to secure firearm storage? Well, in a recent survey, researchers at the VA, including Joe Simonetti, who does a lot of work in this area, have found that 1 in 3 veterans report storing at least one firearm unlocked and loaded. And there may be different reasons why they do so, having to do with home defense, self-defense, and other reasons like that. But veterans also have reported a real lack of trust in having conversations with members of the government. I hear a lot about concerns about the ATF, especially over the past few years, and also concerns about being asked by a healthcare provider or someone at the VA about their firearms and secure firearm storage. And there are some concerns that those conversations may be a disguised attempt to restrict firearm ownership. And that's another reason, language-wise, why we avoid using terms like means restriction and things like that, and really just focus on that secure firearm storage messaging. So what are some of the ways that we can address these barriers? The VA has really been partnering strongly with the National Sports Shooting Foundation and others in the firearm industry to try to get out messaging about secure firearm storage. There are some wonderful resources available that you can order from the National Sports Shooting Foundation. The VA gives these materials out. We give these materials out in our work. And so there's just a lot of recognition that we really need strong partnerships with people in the firearm industry and people like Caleb in order to get this messaging out and promote secure firearm storage. So it's against this backdrop that we were funded by the Department of Veterans Affairs in 2019 to develop the Veteran Informed Safety Intervention and Outreach Network. And I'm not going to go into great detail about our background or our methods. You can always ask questions if you want. But what I really want to convey is that from the very beginning, this was conceived as participatory action research, where veterans, firearm owners, opinion leaders, community leaders like Caleb have been partners in this research from the very beginning, helping to inform every bit of the research along the way. So we started by hiring veteran peer champions who are firearm owners themselves, who have deep connections in their communities, and we hired them as consultants on the project to help inform us every step of the way. Then we wanted to engage key stakeholders in a series of deliberative discussion forums. I'll talk about that in a minute, to understand from them what was their understanding of the role of firearms in veteran suicide, what kinds of beliefs and concerns would we need to address, and what would be acceptable interventions to promote secure firearm storage messaging and practices. And then the final piece of this was to identify partners like Caleb and acceptable interventions that we could implement in the community with community partners. So why did we use deliberative discussion forums? Without going into great detail, I'll just say that we knew there would be a real range of opinions across the board about firearms, how to talk about firearms, what would be acceptable interventions, what would be some of the concerns. And we wanted to really identify potential barriers to working together and to implementing any interventions that we came up with so that we could proactively begin to address those barriers, build trust, and identify common ground, common values that we could build upon as we implemented interventions. So we learned a lot about messaging. We learned a lot about how to promote secure in-home storage, but today we're really going to focus on promoting this temporary voluntary out-of-home storage. So this was a concept that was very well received. We got a lot of messaging from the people we spoke with that this needed to be very voluntary and that any efforts to develop an out-of-home storage network would need to be led by the firearm community with some support from the research team. We heard a lot from veterans and service members and firearm owners who were very comfortable with the idea of storing firearms outside the home temporarily, and in fact had done so. but they really talked a lot about needing to find places to store firearms if someone didn't have a friend or trusted family member who could hold their firearms for them, or if there was concern about stigma. And they also talked a lot about where would you be able to store firearms, and the preference really came through strongly for firearm retailers as partners for storage rather than law enforcement agencies or other places like that. So because there is such a strong focus on this out-of-home storage option, and people shared a lot of stories about doing this intuitively, storing their firearms with a friend or family member, even asking a retailer who is a friend if they could hold their firearms for them, we knew that we really wanted to focus on this option early on. And we heard a lot from people, as I said, who said things like, well, you're really going to need to work with gun retailers. You're really going to need to get them to lead this effort. And also you're going to need to think about a lot of things like, what are you going to do if someone has, you know, a large collection or a large number of firearms? So very early on, people started steering us towards this option of working with firearm retailers. So around the same time, we became aware of some efforts across the country that were really moving in the same direction, or had even moved beyond what we were talking about doing. So there were storage maps already online in Colorado and Washington State. There's a national organization called Hold My Guns that has, I think, 5 retailers across the country who have signed on with them. And we ended up having a great conversation with a colleague of Emmy Betz's in Colorado, who said, you know, you can use our call script. This is how we did this. This is how we onboarded these FFLs to create a network with us, and very generously shared their script with us. So we decided to adapt that script a little bit and make an effort to start to reach out to FFLs in Louisiana and ask them if they would be willing to work with us to provide out-of-home temporary storage. But as we made those calls, we immediately started to run into real serious concerns. And I made a lot of those calls myself. And what I heard was a real willingness from FFLs to help and a real desire to help, but many more concerns than I could be able to address on a phone call like that. People were bringing up really good issues that I hadn't thought about. They would say things like, well, if you just put me up on a map, how am I going to know who's coming to me, who's calling? I won't know what they did with that firearm before they called me. They could be calling from out of state and trying to come across state lines with a firearm and give it to me. They also said things like, you know, I'm not in the store all the time, so even if I'm willing to do this, we really need to train my staff. I don't want somebody to be answering the phone, hearing that we're on a map, but not knowing what to say to the person on the phone. So we kind of regrouped after we made these calls and talked about all of the concerns that we were hearing and said, let's think about another way to do this, because we really want to do this, as I said, with this participatory action research approach. There's more concerns than we realized, and we really need to figure out how to address these concerns. During those calls, my colleague Joseph Constance connected with Caleb and had a really great conversation with him. I think that he found Caleb because one of the FFLs he called said, I think this guy, Caleb Morse at the Rustic Renegade, is already doing something like this, and you really should talk to him. And that's exactly in participatory action research, the kind of person you want to find is a community leader like Caleb, who's maybe already doing something, but could use maybe the support and camaraderie of the research team and a network to help build what he's doing. So I'm going to hand it over to Caleb for a minute. This is a picture of his gorgeous shop, and have Caleb talk for a few minutes about what he was already doing, and then how he decided to get involved with our coalition on the Armory Project.
Thank you. So when we started the program, whenever Joseph reached out to me and had a discussion with me, and he mentioned what was trying to be done, I let him know that I was already doing something similar. And what had happened originally in my instance is a very good buddy of mine that served with me had recently moved to Louisiana from Colorado, actually. Moved to Louisiana, came down, and we got to reconnect and enjoy each other's company again as brothers. And all of a sudden, one day showed up in my shop. So he showed up in my shop, and he was in a bad way. He was having some issues, and said, "Caleb, I want you to take my firearms, sell them, do whatever you want with them. I don't need them. I don't want them." And I said, "Well, let's have a conversation. Let's see what's going on. Let's figure out what's happening, and let's see what we can do." I told him I'd be right back with a cup of coffee for each of us. And by the time I turned around, he was gone. So I didn't know what to do with the firearms. And I didn't want to sell them. I didn't want to do anything else with them because I couldn't just take possession of them like that. So I put them in my bound book with the intent to hang on to them until I talked to Tony again, and Tony got right. And as we moved forward with it, I had more and more people coming out of the woodworks almost saying, "Hey, look, I heard that you did this for somebody. I heard that you're helping. I heard that you have a willingness to help and that you have a heart for this. And what can we do to help you and to work with you?" And before I realized that I had quite a few firearms that I was taking in for individuals, and then trying to help them just get direction and get the help that they needed. And then even with that, I went through and talked to my lawyers, and that was one of the things that we talked about originally. When I talked to my lawyers about what I was doing, they flat out told me that I was crazy. The liability was way too much to hold on to, that there was no explicit liability or implicit liability. There was nothing immediately there. But because I was taking firearms in from individuals who were maybe not in the right mental state, maybe had a drug problem, an alcohol problem, or any of these other things, that I was opening my business myself to a massive amount of liability. And I was going to let stop me from doing good in the community. And we pushed through. And then whenever they reached out to me, and we started trying to see what the VA was trying to do with it, the direction we could go, and we kind of helped to solidify a forward motion with it. It really opened a lot more doors and gave us more direction and more ability to help one another. And I firmly believe we've made a pretty massive difference in our community for sure.
Thanks, Caleb. So now I'm going to talk a little bit more about, once we had identified Caleb and some other retailers through those phone calls that we made. Like I said, we regrouped. We said, how are we going to approach this? Because we want to do this in a different way than calling places and having them on a map. They're bringing up so many good points. We really want to kind of dig in and figure out what we can do to support these FFLs and make this project really strong. So what ended up happening was that we identified 4 retailers, including Caleb, who participated in development of this program from soup to nuts, just talking through every single aspect of it through multiple meetings, working through all the problems and issues, and really clearly defining what roles were the FFLs going to play, and then what were we as the VA kind of research team going to play. One of the pilot members had to drop out because of health reasons. So we had 3 people who kind of worked with us all the way through and then implemented the pilot program that I'm going to talk about in a moment. So one of the big issues that came up when we started having these regular meetings of the 4 FFLs that wanted to help develop this was, what could the storage process look like? We got a lot of feedback that we needed to find a balance between the process being really organic and decided upon by the individual FFL based on their processes, what they felt they were capable of doing, what options they had within their store, versus having a very formal process. Everyone kind of said, we do need some kind of help or guidance in how to create a paper trail for this that will protect the firearm owner and the FFL, but will not be a barrier to participation. So we got a lot of feedback that we needed to be able to provide some guidance to FFLs without being overly prescriptive. So the 2 options that we ended up coming up with as a group, and if I'll stop in a minute and let Caleb weigh in if he wants to give more better information about this than I can, but the 2 options we came up with were that some of the FFLs had gunsmithing and cleaning as an option. And so they were able to take the firearms in and say, like, okay, I'm going to clean these firearms, take care of them for you, and give them back to you when you're ready. And some didn't have that option. And some FFLs preferred to use the consignment hold kind of process, so that they would take the firearms in as if they were going to sell them, but instead of selling them, hold on to them until the person was ready to get them back. In that consignment hold option, the firearm owner has to pass a background check again to get their firearms back. And I'm going to stop here and let Caleb say if there are other aspects to it, but essentially the feedback that we got was we needed to help these FFLs develop some processes, but then step back and let them do it in the way that worked best for their shop. Caleb, do you have any comments about that?
Yeah, so as a FFL, a federal firearms license holder, when you acquire a firearm, you have a book called your A&D, your acquisitions and dispositions. And when you acquire a firearm, there's no process to acquire a firearm simply to hold on to it for someone. That was never thought of whenever the ATF wrote their white papers and gave direction. So you can acquire it for sale, for self-property sale. You can acquire on consignment to sell for someone else, or you can acquire for repair. So we looked at the consignment option and the repair option. Those gave us two really good options to bring them in. In order to be 100% truthful, when we took them in on repair, we would repair the firearm. We'd go through it, clean it, make sure it's maintained properly. If it needed any other work done to it within means, we would go ahead and take care of that for the firearm owner. The benefit, or not even the benefit, the reason we did do the two is in our initial conversation. If we're talking to somebody and they understand that, hey, look, I'm in a rough spot right now, maybe some depression, some alcohol, drug use, or anything else, and they want to improve themselves and get better, we can take it in on repair. And whenever they come to pick up their firearm, there's no background check needed. They simply come and get their firearm whenever they feel better about themselves. We don't require them to have any documentation that they've gone through, because that's not my role. My role is simply to create distance. That's what we wanted to do, because we don't want to restrict people's right or ability to own property that they already legally own. On the consignment part of it, if they came in and they seem to be having a little bit more difficulty and we're trying to figure out a direction or didn't want to take a direction, and we give them direction with it, we try to point them in the direction of the VA, of other clinics that we utilize, of drug and alcohol addiction clinics as well, something to help get forward momentum. Just that way they can turn the life around and maybe stop those thoughts and realize that it's not all doom and gloom. Depending on how they took that conversation, we take it on consignment. We take it on consignment, and there's a contract that we draw up beforehand that says, look, if for some reason you don't want this anymore, if you don't want this firearm back, if you think, look, I don't need it, and this is all across the board on both aspects, we can either buy that firearm from you, or we can sell it and in turn pay you once it sells. That way, at least you get something out of it, because our goal ultimately is not to hang on to your property. We want you to have your property or compensation that you agree to on your property. Both of those gave us everything within our legal parameters as an FFL. It covered all the bases, all the check boxes, everything else that it had to where we gave someone that back their property and acquired it properly in our book, because it has to be acquired.
Thank you. So I think a follow-up point I just want to make based off what Caleb is talking about is to make the point and the observation that we could not have conceived. We heard all these questions and concerns from the FFLs when we were calling them and asking them about being on a storage map. But as researchers, as people trying to provide technical assistance, as people who, mental health providers or whatever, who wanted to support this effort, we could not have understood and been able to respond to all the issues that the FFLs have to think through in order to do something like this. So only they could kind of get together and talk through these things with some support and guidance and work and structure from us. It really was a collaborative effort to try to think all these things through. And I know that, I'm going to talk a little bit more about our community practice that we have, but I know that we could never have understood all of the pieces and questions that Caleb and the other FFLs had. And so it was by coming together that we had the strength to kind of figure all these things out. So we had identified a lot of barriers through our discussions with our pilot group about things that would need to be addressed as we developed and piloted this program. And we had the understanding that we were a very small group with 3 FFLs at that time who are going to be implementing this and kind of trying it out in a very experimental kind of way, identifying issues as they came up and then figuring out how to address them. So I'm going to go through these pretty quickly, but then people can ask questions at the end if you want to. So one of the things we identified was that we really wanted to ensure quality and integrity of the program. So the FFLs who were working on this with us said, not just anybody can do this. We're going to have to really think about how to identify and support the retailers and staff so that this program has integrity. And we know that if a person in need and crisis goes to one of these retailers, they are going to get help and they're not going to be turned away and, you know, potentially end up in more of a dark place than where they started. We talked a lot about space and storage constraints. So some of the retailers said to us, I don't have a lot of room. I'd like to keep any firearms that I store separate from the rest of the firearms in my store. And so I may need to identify a different space or buy a small used cabinet or gun safe to keep these firearms in. So for this pilot project, we provided a very small amount of funds to support the retailers in whatever they felt they needed to buy or do in order to create that separate space. We didn't want there to be any financial burden to participants. So if someone was in need and crisis, we didn't want there to be a financial burden to them that would be a barrier to them storing their firearms at the retailer. So for this pilot project, the retailers agreed to free or very low cost storage. I think everyone had it for free and maybe said after these have been stored for a year, I might charge something like $10 to $15 a month to continue to hold these firearms. Again, this wasn't prescribed in any way. This was up to each retailer to decide how they wanted to do it, what they wanted to charge, et cetera. We heard from the FFLs that they felt like this could be kind of a challenging concept to explain to their customers and others. And so we worked together to develop a trifold brochure and other materials, including a graphic medicine booklet to help explain this process. And we had a lot of conversations about whether to focus on suicide and mental health in the materials or to be more broad and talk about all the different reasons why someone might want to store firearms temporarily outside the home. And we decided to kind of go into a middle ground where we did talk about mental health because we felt like this was an opportunity if this person was in need, or even if someone picked up one of the materials and thought, well, I may have a friend in need someday. We didn't want to skirt around the fact that this is suicide prevention work or that this might be because of a mental health issue. But we also wanted to agree and point out to people and acknowledge that there may be other reasons why people would want to store firearms outside the home temporarily. We talked a lot about space constraints for displaying the materials that we had developed collaboratively. And so we made an array of materials of different sizes based on, you know, and then let the retailers choose which ones fit best in their store. So we have window clings, magnets, decals, and big banners and things like that. Caleb has a huge banner displayed outside of his shop in the parking lot. There was a lot of concern about mistrust of the VA and government and being involved in this. And so we worked really hard with a memo to kind of clearly define the role of the VA or the researchers versus the FFLs so that they would be able to explain that to their customers and say things like, yes, the VA is helping with this, the VA is involved with this, but I don't report back to the VA the names or any information about anyone who stores firearms with me. And then finally, the FFLs really talked to us about some of their concerns about lack of knowledge about mental health and why they were doing this, especially among their staff. And so we worked together to develop and deliver a training to staff at every FFL that joins this coalition. So these are just some of the materials we developed. They're available for download from our website. We have a trifold brochure and a graphic medicine booklet. And as I said, we decided to center mental health instead of steering away from it, but also to talk about all the other reasons why someone might want to store firearms outside the home. The training for the gun shop staff was about 60 to 90 minutes long, depending on how much discussion there was. It was conceived as being very interactive and dialogic so that we could talk about things like what are some common myths or concerns, or what barriers did the staff see to having these conversations or having this program in their store, and how could we talk through them? We wanted to really raise awareness among the staff about the role of firearms, in suicide, and why time and distance is such an important intervention. We talked with the staff just kind of about some of the stats in our state, really raising their awareness. We also talked about how to have a conversation with someone if you had an indication that they might be thinking about harming themselves. We use the SAVE model to talk about, signals, looking for warning signs, how to ask the question, how to validate someone's feelings, and then how to engage them and help them find care that they might need. So we brought a lot of resources to the stores so that staff and owners would be able to identify resources through the VA or in the community that they could steer the customer towards if the customer was concerned about themselves or someone else in their family. And as a result, I know that, just to give an example, the suicide prevention team at the VA that is near where Caleb's store is located, we really connected them with Caleb, and they started calling on Caleb, coming into his store, asking him for help and advice, and trying to work with him closely. So just trying to move some of those connections between the VA and community resources and the FFLs to move those conversations forward, I think was really helpful. So we also talked a little bit about the Veterans Crisis Line and kind of tried to demystify that for the staff, because we heard from staff who said, well, that's just a phone number. It's just somebody palming off a person in trouble onto a 1-800 number, an 888 number. But we really tried to talk about how the Veterans Crisis Line actually works and how someone who calls in there gets follow-up from their local VA within a short period of time afterwards. So then we implemented the pilot at 3 locations, going and delivering that training in person, having great conversations with the staff, getting to know everybody a little bit, bringing the materials. You can see, like I said, Caleb has a big banner up at his store. And we worked with Caleb and the other 2 pilot sites to stay in touch through monthly community of practice meetings. And then on a weekly basis, we sent them questions via text to ask how things were going, whether they needed more materials, whether they or their staff were having any conversations with customers, and whether they had stored any firearms for anyone in the past week. So that was how we were tracking kind of the outcomes and implementation for this project. So I'm going to talk a little bit pretty quickly about some of the outcomes and impacts that we were able to track. So we trained 16 staff. And we found, we did some pre and post questionnaires prior to the training and afterwards, and found that through the training, there was a significant improvement in knowledge in terms of believing and understanding that many suicides can be prevented and that firearms are the most common means, and also decreasing the belief that getting mental health care means that someone will not be able to own firearms in the future or get their firearms back. That was a really big deal, in the conversations that we were having with people. And we did find that the training decreased that belief. And also that it improved kind of the attitude in terms of thinking about the importance of discussing safe, secure firearm storage with customers, and confidence in discussing secure firearm storage with customers. We also looked at a number of process measures for this pilot implementation. So we looked at the attendance of the FFLs at the monthly development calls I talked about, kind of developing the intervention, and the community of practice meetings that we continued to have during the pilot phase, and also their responses to the weekly text questions that we were asking them. We found an 86% attendance rate across all of those meetings. It was quite a lot of meetings, and these are very busy people. So I think that was a pretty incredible commitment on their part. And a 96% response rate to the weekly text prompts that we were sending out during that 4-month pilot period. We looked at fidelity of implementation of the materials that we had handed out. So we just came up with a 0 to 4 point scale, with 0 being no materials displayed at all, up through 4 being all the materials being displayed prominently, including things like having tabletop signs next to the cash register, having tap brochures displayed throughout the store and next to the cash register, things like that. And we went and visited each store kind of partway through the pilot period to just observe how the materials are being displayed, and found that all three had the materials displayed prominently throughout the stores. In every single store, the tap brochures were right next to the cash register, and there were tabletop displays kind of all throughout the store. Caleb had put them up near gun safes for sale and things like that in his store. And over 1,200 of the brochures that we had given them had been distributed through the 4-month pilot period. In terms of effectiveness, we looked at conversations and inquiries as they reported them to us via that weekly text. And during that pilot period, we found that there were 28 very serious conversations, kind of significant conversations about the possibility of storing firearms, and that 2 FFLs had stored firearms for 8 customers and destroyed firearms for a 9th customer. Maybe Caleb can talk about that in a minute. And the 3rd FFL was kind of onboarded the latest during the pilot period and was having conversations and was close to storing firearms, but hadn't actually done it by the time that we were done with the pilot and measuring these outcomes. But another thing that I think was really important is that in those community of practice calls, we were having conversations constantly about sort of emergent concerns and scenarios that were getting raised and how the FFLs were addressing them or planning to address them. And they really shared a lot with each other about how to do this. So just to give an example, you know, they kind of came up with the question of what's going to happen if a customer doesn't pass a background check when they come back to get their firearms. How are we going to handle that? Or what are we going to do if a family member comes in with firearms and says they want to store them on behalf of their loved one, and they're not the owner of the firearms? Or what are we going to do if we have a small store and somebody comes in with 15 firearms or more, a large collection? So through that community of practice, Caleb and David and Brandon were actually to kind of answer those questions for each other and help and support each other. Just to give an example, Caleb has offered to be the person who stores a large number of firearms for a smaller FFL. If someone comes in with a large number, he has a larger store and he's willing to store a large collection. Caleb, I'm going to stop there for a second and see if there's anything you want to add about, you know, how that process went for you or how those community calls were helpful.
Yeah, so having those conversations brought up other questions that either we hadn't thought of or just a whole different dynamic that may have happened in another area of the state, things that we hadn't come across yet. So it really helped us stay ahead of the curve. We got to build upon a community of knowledge instead of just relying on ourselves, which was very, very beneficial. And even like you discussed, the ones that we destroyed, that instance came about. We had a gentleman come in whose son was having an issue. His son was is a veteran, and was having an issue and brought us the firearms on behalf of their son. Now, the way that it works is we acquire the firearms from the person that brings them to us. The actual owner at that point is irrelevant. He did let us know that it were his son's firearms. We annotated all that information and took it in that way. And then shortly thereafter, the decision was made on behalf of the person who brought them in that the firearms would not be brought back. Unfortunately, that was another instance where I don't want to say not enough help, but maybe there wasn't the timing wasn't the best, and the individual took their life. The dad did not want the firearms back and decided instead to have us destroy the firearms. So we destroyed them as per federal regulation, and it helped give him closure. So that was beneficial for him. From there, that brought in new questions, new comments, how to figure out what we would do and a way to methodize that. And that was shared between the collective hive. Through there also, we talked about the number of firearms that I had taken in my business and then the numbers that were taken into the others. And that's whenever we all decided and agreed, because I had a larger safe, because I had a larger location, that it made more sense for me to take them in, and we would just annotate that way there's a proper chain of custody the entire way. Because I'm acquiring them from another federal firearms license, we'd annotate notes and so forth, and they'd hold as many as they could. And if they had overflow, they would send us an overflow, and we'd hang on to those as long as possible, as long as we needed to and they needed to. So it gave us a strong network internally, as well as the external network being through the VA and all as well. So it was very, very beneficial to us.
Thank you. So we also had qualitative interviews. We went out and conducted qualitative interviews with the gun store owner. and then separately with their staff to ask some questions about what they thought went well, what they thought were maybe some continuing barriers, and how they felt about this, this program being in their store. We found that the training was universally endorsed by retailers and staff alike, and that actually they felt like they would really like a refresher training. They suggested that we create maybe a video training for any new employees who came on in the store. So that's something we're working on. And they really said that they thought that was important for any future retailers who joined, was to get some kind of training like that and what to say, what not to say, what kind of language or wording can help, and what's just plainly not going to help. As Caleb just said, the retailers said they found the community of practice meetings very helpful. As one person said, that's the biggest help, hearing from the other guys and what's working for them. I stole my idea from, I'm just going to say it was Caleb. It was to get the word out by reaching out to our local sheriff. So Caleb had been doing a lot of outreach, telling a lot of people about the Armory Project. And a couple of the other guys said, you know, that's a great idea. I'm going to start doing that as well. The materials that we developed collaboratively really helped stand out. And spark conversations. People were having a lot of conversations, and they felt like one of the kind of side impacts of this program was just getting the word out and having people become more aware of out-of-home storage as an option, and tell people in their lives about it. And the retailers universally said to us, we're going to continue this program, and we're willing to serve as mentors to any new FFLs that onboard with this program. Another thing we heard that was really interesting is just how participating in this program, having the training, having the materials in the shop had really changed the culture in the store in terms of talking about mental health and firearms and suicide prevention. So the owners felt like it was really helpful as a way to talk to their staff about, you know, we want to help our community. I think Caleb has shared stories with me about other things that happen, people coming in who are dealing with things like intimate partner violence, domestic violence, and coming in and talking to Caleb or others in the store, and Caleb and his staff kind of knowing how to handle that and thinking through how to get that person resources. So it kind of spread out from thinking about suicide prevention into other issues that people might be dealing with. And the staff said, it was helpful for them. I can say that in the training, many of the staff I interacted with had lost someone to suicide in the past, or even during the pilot program that happened. And we were able to provide some post-vention resources and information. I think it was helpful for people to just start having those conversations. We also heard in those interviews about how we could sustain and strengthen the program. One of the things that we heard was that we really needed to ensure that this was minimally, you know, kind of minimize the administrative burden to the FFLs. So we had kind of said to them, would you be willing to take this on yourselves and run with this if we stepped back? And what we heard was, no, we're really going to need some continuing support from somebody. If you just step out of this, I will keep doing it myself, but that there wouldn't be this community of practice or this kind of network or the ability to have a map or anything like that. People said to us that the financial support we provided was really helpful, but not necessary, and that they would have done it anyway, but it did make it helpful for them to have a separate place for storing firearms. And we also got some good feedback on more guidance on how to have conversations. So we're developing a toolkit and also just really thinking about how staff can practice having these conversations with people and ongoing using the community of practice that we've talked about to continue to problem solve any issues that come up. One of the main things that came out of these interviews and just the ongoing conversations that we had with Caleb and others was what Caleb mentioned earlier, which is how these FFLs are really taking on some risk when they do something like this. And so we actually work together as a coalition, and maybe Caleb can talk about this for a minute, but we work together as a coalition to pass legislation in our state that provides immunity from civil liability for an FFL that that does a temporary hold for someone. Caleb, do you want to talk about that?
Yeah, so the biggest fear, and it was, my lawyers told me it was an issue, and then every other shop that I ever approached and talked about the Armory Project with, It was, what about the liability? What are we going to do? My entire livelihood is at risk whenever I take these in on hold. So shortly thereafter, we began looking at things we could do to help mitigate that. And that's whenever, through the support of everyone else, we realized that, look, the best way to do it is to absolve us of that liability, and have to go through the legislative process and kind of figure out how that works. We were very, very fortunate it passed unanimously. No one had any issues with it whatsoever. And I think what helped us is the vagueness of it, because we wanted to make sure that we didn't pigeonhole ourselves into one specific situation. We wanted to make sure that while it absolved us of the liability for this, it also gave us the opportunity to have the conversation, the real conversation with individuals about what was going on, and the issues that we were having as a veteran group. And I'm very, very grateful that we were able to get it moving forward. And I know that since we've had this law passed, we've had more FFLs come on board and more people appreciate the work that we're doing.
Thanks, Caleb. So just to kind of wrap up and maybe have a couple minutes for questions. The original gun shops are all sustaining partners in the Armory Project, except for one FFL that closed, and 4 new FFLs have joined. So we have a total of 6 locations right now. We did end up creating a storage map online after getting permission from the FFLs that we worked with, that they were okay with having a public facing map. We're developing an implementation toolkit that will be hosted on Vision. I know that the Colorado group has an amazing toolkit for creating online storage maps. Ours is just a little bit more focused on the partnering aspect with FFLs. And then we're going to continue to add FFL partners and develop TAP materials to display in clinical settings, so that healthcare providers in the VA and patients will be able to know about this option, and then hopefully also outside the VA as well eventually. So what are some implications for out-of-home storage? Our community engaged collaborative approach obviously has a lot of pros and cons. We have a lot fewer storage locations so far compared to a lot of the other maps across the country. And we do need resources to build and maintain our partnership, but we have had the ability to track barriers, facilitators, and outcomes throughout since the beginning of our project. We know that our locations are current and have trained staff with supported owners who are regularly attending these community of practice calls. And so that's, it's kind of a tension between the amount of resources and work that goes into this and having fewer locations, but then actually knowing that they've attended these trainings and that they're kind of staying up to date on this work and getting access to resources from us and each other. So what do we think are some of the implications for some of these states with current maps or interest in maps? Obviously, there could be legislation like ours in Louisiana to provide immunity from civil liability. That's been a big help in onboarding new FFLs. I think that hopefully states or the federal government will provide some kind of funding to support FFLs joining coalitions and maps and providing training to gun shop staff, such as what we've done. And then I think that even within states, injury prevention efforts within state government or maybe, Department of Veterans Affairs or wherever this might sit within a state, could really think about providing technical assistance and support to FFLs like Caleb's to be able to, to do this very labor intensive work that they do from the heart and to maintain the quality of what they're doing. So I know we wanted to have time for questions and we probably went a little long, but we'll stop there and see what questions there are. And thank you. Caleb, did you want to add anything before we start on questions?
No, I was actually looking at some of the questions now, and I see one from Ms. Mack where it's asking about how do we see the intersection with secure storage person who's not ready and willing to part with their firearms? And I think, well, I know that goes back to this being a voluntary program. We go in, we have the conversations, and I've talked to people who others recommended come have a discussion with us, who they said, look, Caleb, this person is they're having problems. They're having depression. They mentioned this the other day. We had the discussions, and if they're not ready for the help, they're not ready for the help. I mean, all we can do is offer a helping hand and an open mind, and plant seeds. And if they're not ready to use the program, then I hope that they'll be there to use the program when they are ready.
All right, thank you for that. Everybody, we have a few minutes left, so if you have questions, please just add them into the Q&A box and we can get to them one by one. Thank you for this awesome presentation. I think that, you know, as within the VA and other healthcare systems who are trying to sort of move the needle on firearm suicide prevention and have what can be fairly challenging conversations, we get some naysayers sometimes who say, you know, this doesn't make any sense. People love their guns. They're never going to part with their guns under any circumstance, even if temporarily. And so it's nice to hear experience of what we know clinically, which is that when people are going through hard times, they sometimes do recognize that firearm access can be at risk, and they're willing to do hard things with them in some circumstances. So it's nice to see data on that. I also appreciated one of the obstacles we all know about, and you alluded to, is that individuals are concerned about getting mental health care and whether that impacts their firearm rights, and how you were able to look at a pre-post sample among some of the staff that you're working with and show that you were actually able to impact that in a positive direction. And among a group of people who are, you know, opinion leaders, probably they're probably influencers with the firearm community. So that's a huge thing that you've been able to do. Caleb, I have a question for you. So you alluded to, or you sort of reflected back on a couple of really difficult stories among some of your customers, and I'm sorry that you and your staff had to go through all of that. How common do you think that experience is across retail and shooting settings? I mean, I can't imagine that you're a one-off. That's not my experience in hearing about these things, but what's your sense of how frequently individuals such as yourself in the community are engaging with people who are at risk and have events like that?
I can only speak from my experience, and I know that I have these conversations now probably weekly, and because I kind of seek them out. These conversations are very difficult, and I've learned that if I can't face them head on, then I'm going to shrink from the experience instead of rise to the occasion. So I have very direct conversations. I've had conversations with other FFLs, like in Florida, who've had suicides on their grounds before. They were indoor ranges and had 2 indoor ranges, and both had a suicide instance there. We talked about what happened before, what happened afterwards, and things that they could have done better or differently. So I mean, I definitely, in my shop, it's a weekly conversation.
Yeah. Question from Dr. Betts: for sites not doing this yet, how do you start? How do you find a quote Caleb champion? How do you make those connections?
I mean, so I can speak to, you know, when we were, I mean, I do a lot of work in the community. Like, I spend a lot of time at veteran service organizations, a lot of time at community groups, like 2A affinity groups. And I found the first person who worked with us, his name is Brannon, through just basically every group I went to, they would say, do you know Brannon? Do you know Brannon? It's like he was obviously well known in the community. And I went and met with him, and he was incredibly challenging and skeptical. Caleb knows him well, and Caleb does not suffer fools gladly. And he was really sure that I was there to try to take people's firearms away. But I sat with him, I kept showing up, I kept talking to him. I kept answering his questions, and eventually he became one of the greatest champions of this. Unfortunately, he was the FFL that closed, but that was one way to find him. Caleb, again, people just knew. As soon as we started talking about this as an option, people said, you have to talk to Caleb Morse at the Rustic Renegade. Caleb had worked at another shop before you started your own, right, Caleb? And people just knew you. And your name came up over and over again. And so once we came out and visited the store and spent time with you, we knew that you were going to be a really strong partner. But I would say that the other partners are strong too. It's just sometimes they want to see somebody else go first. And sometimes it really helps. I know a retailer that I just onboarded recently had so many concerns and worries. And when I told him about the legislation and I told him that Caleb and others were involved, he just immediately said, yes, I'm going to do this. I'm on board. So, you know, it gets momentum after the original people get on.
Thank you. Okay. With that, we are at the top of the hour. So I want to thank you, Mr. Morse, Dr. True, for being here today to present this work. This is truly fantastic. Thank you for leaving your contact information in the box. I'm sure people will reach out with other questions. And everyone will advertise and look forward to seeing you at our next webinar. Have a nice day.